With respect to vaccines, the government has been clear, our Premier has been clear, we will not mandate vaccine requirement for schools and for staff at this point. That's not a decision point we're going to proceed with. Our aim is to encourage vaccination at a voluntary level.
Ontario Education Minister Stephen Lecce says a vaccine mandate is not part of the Ford government's plan for reopening schools this fall, but Lecce and the province's chief medical officer say schools should be able to remain open with the measures they're putting in place. We requested an interview with Stephen Lecce, but he was not available. So we're going to go to get some reaction from the leaders of the provincial NDP and Liberals, starting with Ontario Liberal leader Stephen Del Duca. He's in Vaughan, Ontario. Stephen Del Duca, thanks for joining us and talking to us today.
My pleasure. Thank you for having me on.
You are calling for mandatory vaccinations for education workers. Earlier today, Minister Stephen Lecce said mandatory vaccinations are not on the table. Meanwhile, about 70% of eligible Ontarians are fully vaccinated at this point, as you know. So why do you think it needs to be mandatory?
Well, look, the most important job that I have is not as a political leader. It's actually as a dad. My wife and I are raising two daughters. They're in the publicly funded system. Our older daughter is heading into grade 9 in a few weeks. Our younger daughter into grade 5. We witnessed firsthand how brutally tough last year was on everybody, on our kids, on students, on parents, on teachers, and so many others in the system. And it just seems to me to be the responsible and reasonable thing to do for both education workers and healthcare workers on the front lines to make the vaccinations mandatory. Nobody's tracking it. That's the other crazy thing to me and my wife. We don't even know if the workers in our daughter's school this September will have the vaccinations or not. After everything, and look, by the way, I suspect most frontline workers are getting it, but I think parents and others in the system, in order to stay safe and have that peace of mind, they deserve to know that we are moving forward decisively and responsibly. That's why we've called for it. And I'm the only political leader in Ontario who has made that call so far.
And so what would happen to staff who refuse to be vaccinated if it was mandatory? You know, there are legitimate reasons for not wanting the vax, separate from the broad hesitancy felt by some.
Yeah.
What would happen to staff in that situation?
Yeah, no, it's a great point. And so that's why we said from the very beginning a couple of things. One is I don't want this to be punitive at all. I don't want a single worker to lose their job. I want to make sure we're respecting the Human Rights Code. So look, as an employer, the province or school boards or hospitals, working with the individual worker, if they're represented by a union, to work with their union, to get them to a good spot so they understand, with medical advice, why the vaccination is so important. And at the end of the day, if none of that can be achieved using that creativity or innovation, a person could be redeployed so they weren't student-facing, they weren't patient-facing. But after everything we've been through and how brutal this ordeal has been, I think that we collectively deserve the peace of mind knowing that our frontline education workers and healthcare workers have done the right thing. They've gotten the vaccination to keep them safe and to keep the rest of us safe. It is the responsible thing to do.
But, just on a classroom basis, for example, you want a cap on class size, right?
A hard cap.
Theoretically, doesn't, you risk having fewer teachers, which would mean larger class sizes, no?
No, I don't look at it that way at all. Our plan that we released a number of weeks ago, because, I still feel that Doug Ford should have released his plan weeks ago. I think the fact that we've just heard news today and yesterday with only being a few weeks away from the start of school tells me that, sadly, Doug Ford hasn't learned any of the important lessons of COVID, because this is exactly what we had to go through last year, and it was just so brutal. But no, our plan called for the hiring of new teachers. We know teachers exist in the system who are certified, that we should be able to lure back into the profession to make sure we have a hard cap of 20. And that hard cap of 20 this time around is mostly so that, yes, kids can remain physically distant and be safe, but it's also so they can get that in-person instruction. So teachers and others can assess any learning gaps that might exist because of how tough last year was. More supports for kids with special needs, more supports for kids with mental health challenges, which we know will be off the charts, and a real investment to match what the feds have said around providing better air ventilation and air quality in schools. That's what we called for more than a month ago. And what we've seen from the provincial government today, it really comes up short, and it's deeply discouraging.
What about rapid tests, as the Ontario NDP would have it for education workers? Would you support that?
Yeah, look, at the end of the day, rapid tests might be a decent plan, but it still falls short of a call for mandatory vaccinations. I'm a little bit at a loss. I get why Doug Ford wants to play to part of his base that's very libertarian in nature. And, he's got one eye or both eyes fixated on next year's provincial election campaign. Not quite sure that I really understand why Andrea Horvath and the NDP are not doing the right thing in terms of calling for mandatory vaccinations. To me, it's a little bit half-hearted of a half measure to talk only about rapid tests and not have the other half of the conversation. That's why I'm really proud that Ontario Liberals are showing responsible and decisive leadership here. That's why we're calling for mandatory vaccinations, again, not to be punitive, but because it is the right thing to do.
I mean, I guess everybody's, in fairness, trying to find a way forward on this. So we've got, Minister Lecce saying another 20,000 HEPA filter units will be in the schools, as again, a way to mitigate the threat, I suppose. I mean, is that not a positive step, for example?
So the federal government provided funding last year of just over $500 million, $525 million for better air ventilation in Ontario schools. The plan we put forward weeks ago said, look, Doug Ford's got the money. We know that he's underspent by close to, or actually over $10 billion this year. That's according to the Financial Accountability Officer. That's money that was earmarked to go into things like safer classrooms so that our kids, my kids and yours and others, could remain safe and healthy while at school, so the schools could stay open. So I don't understand why a $25 million investment, when we know that we have 5,000 schools in the publicly funded system. There are nearly 2 million kids that attend those schools, a couple of 100,000 frontline workers. Why you wouldn't want to use every tool in the toolkit and make the kind of investment and effort to provide safety and security is just beyond me. But clearly, Doug Ford continues to demonstrate he doesn't value publicly funded education the way that we need a premier in this province to do so.
Dr. Kieran Moore, as you'll know, is talking about how COVID, ultimately would have to be normalized in schools, sort of like the flu, I guess. What's your take on that? Is that a reasonable way to look at it?
Listen, I have a ton of respect for Dr. Moore, the work that he did in his local public health unit in Eastern Ontario before he became the Chief Medical Officer of Health. I would say that, and I'm not a medical expert, I'm not a doctor, I'm not a scientist. I would say at this moment in time, while I'm sure it's on some level medically he is correct, I think it's a pretty tough pill for people to swallow at this moment, only a few weeks ahead of the school year starting, when there is so much anxiety that we all feel. To be told that we should, just accept that COVID is like the flu, which is exactly what we have tried to stress it's not like over the past year and a half, because of how serious it's been and how seriously we've taken it. I'm sure it's well-intentioned advice, but I have no doubt that is a tough pill for the people of Ontario to swallow at this point in time.
Ontario Liberal leader Stephen Del Duca, thank you.
Thanks so much. You take care.
Thanks. And joining me now is Ontario NDP leader Andrea Horvath. She's in Toronto. Hey, thanks for joining us.
My pleasure, Paul.
You've been listening in on that interview. Meanwhile, you have called for education workers who are not fully vaccinated to take rapid tests. Dr. Kieran Moore noted today that with low community transmission rates, there is a significant risk of false positives when you go that route, and that they would be cumbersome. Does he have a point?
Well, I think we can't call anything cumbersome if it's going to provide a sense of safety for our kids, for our education workers, and for our families. Unlike Mr. Del Duca, I don't take lightly people's charter rights, and so that's why what we're saying is rapid tests or your vaccination status and being vaccinated. So vaccination or rapid test before going to work. It's the very least we should be doing to make sure that folks are safe at school, that our students are safe at school, that our workers, our education workers and teachers are safe at school. I really think that we can't simply ignore that there are folks that are not going to get vaccinated. And I don't think that the right thing to do is just to shut them out, as it appears that Mr. Del Duca is prepared to do. So, I mean, I am disappointed, though, Paul, with the plan. I think it's a bit of, rolling of the dice, really, and our kids may be the ones, in fact, that pay the price. And I'm very concerned. There are things that could have been done. We just talked about the vaccines, but we still could have had smaller class sizes. The government is talking about, and Mr. Lecce is talking about things like HEPA filters, but where's the standard? So how do we know if any particular ventilation solution in any particular classroom or school is effective if there's no standard by which to measure the effectiveness of that solution? So it's a pretty paper-thin plan, and it's one that we're really concerned about. And I still believe, and I know that it's the case, that people need to have paid sick days to be able to take the time off to not only get vaccinated, but to deal with possible side effects of those vaccinations. And I think both education workers and teachers, as well as parents, need to have that kind of financial security to get them through that last mile. We've been asking for a last mile approach from this government, and unfortunately, we haven't seen anything yet.
But why not go the vaccine route? I mean, from the notion that testing is great, but that vaccines are that much. I don't want to say better, but that it just gets you that much closer to security.
Well, I mean, I think any time that you're mandating something for people, as opposed to finding, the reasons why that they're not vaccinated and reducing the barriers that remain, because we do know that barriers do remain, it's a better approach to reduce the barriers. And even if that doesn't bring 100% vaccination, then the fallback is the rapid test. And I actually believe that the rapid test will also be a way to encourage people who are able to get vaccinated, who don't have a health issue around vaccination, to be able to do so. So again, I think there's a little bit more digging that we can do to provide people the opportunity for vaccination and to reduce barriers. And I think that mandating people, saying everybody must do this to be able to work in a school or in a healthcare facility. I think the approach that University Hospital has taken, other hospitals are taking the same approach. I think the Windsor Hospital is doing that as well. I think that makes a lot of sense.
So let's move from, I guess, teachers to students for a second. You're calling for the COVID vaccine to be added to the list that students need to either, prove they've been vaccinated or, have an exemption in order to register for school. Minister Lecce saying that they're not mandating vaccines, but will encourage people to get them. Why should that extra step be added for students?
Well, I mean, for those students who are eligible for a vaccine, eligible to receive a vaccine, I think it's really important that we, that we set that expectation. I mean, we do it with whooping cough, we do it with measles, we do it with a number of other ailments, because we know that schools can be petri dishes for disease to spread, for communicable diseases to spread. And so it really is, I think, something that we're all accustomed to doing, and as we become more, I think, in tune with where COVID-19 is going to go, it just makes a lot of sense to add that to the list.
And what about the kids who, don't have the vaccine or the exemption? What happens to them?
Well, I mean, I think that's something that we already grapple with here in Ontario. I mean, where folks choose not to vaccinate their kids, or where kids can't be vaccinated, that's up to the local public health authorities to address those issues. But I think by putting it on the list, what we do is, I think, elevate the seriousness of the responsibility for parents to get those kids vaccinated, and we need to make it easy for those parents to ensure their kids are vaccinated in the next couple of weeks. And I mean, I wouldn't disagree with Mr. Del Duca when he talks about the disappointment in terms of the timing of all of this. We know that British Columbia, for example, they put their plan out, a full, very detailed plan for back to school in June. And here we are once again with this conservative government, with Doug Ford laying out this this last-minute thin gruel of a plan, and it raises anxiety levels. Parents have been through enough. Families have been through enough. The least we should have done is had a plan that was well in advance of where we are now, and that was really clear. It was shocking to see yet again the government put a plan out yesterday and then change it up a little bit today. That's not what parents need. They need a sense of competence in terms of what the government brings forward, but unfortunately we don't see that.
Would you disagree, though, with Minister Lecce in saying that it is a positive thing to have another 20,000 HEPA filter units, to be mandating masks for the students while indoors, unlike, for example, the approach in Alberta? Are those not, in fairness, positive steps in Ontario?
Well, again, the mask issue for sure. The HEPA filters, I just want to say that throwing a little bit of money that was already in the mix at the HEPA filters is, I guess it's fine, but if you don't have a standard, how do we measure whether there's effectiveness in terms of the air quality and the air cleaning? I mean, this is what's missing. We don't have a standard. So how do we measure whether, in fact, we have an effective solution when it comes to any kind of ventilation changes that might be taking place? I think that's where the big fail is here, is that the government has cut $800 million out of the education budget at a time when we need more resources to support our kids who have gone through such difficulties in terms of learning loss, in terms of mental health challenges, isolation. I mean, all of these things would require more investment, not less. And that's very disappointing to see that Doug Ford just doesn't support, those kinds of investments for our kids.
I'm thinking the Ford government would challenge you on the $800 million, but we'll save that for another day.
Financial Accountability Officer number.
Ontario NDP leader Andrea Horvath, thanks for talking with us.
Thank you, Paul.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.